shoulder. When you pull your sword out, right? What kind of rotation is that? External. When you put it back in, it's internal. So there's the ASIS again and the AIIS. So then you can count down or you can go down the finest processes of the sacrum.
Is this on the secure side?
Is that?
This?
No, this is in the this guide, the trail guide book.
Is any of it on the secure side?
No, I can't put that on the secure side. I might be able to put the slides on the PowerPoint stuff, just as long as somebody turns me in for copyright. Nobody works for the FBI, right?
Matthew does. I gave it up for mine.
Okay, so then the sacroiliac joint. Okay. Now this is something that we could talk about here. So why don't you want to come up and I'll chart it for your sacroiliac?
Stop listening to music here. Come up there and help.
I guess maybe you should point the camera over at the table here. So when you find the PSIS, if you go medial to that, what's right there? The sacroiliac joint. Right? So you're not necessarily going to be able to palpate deep into the sacroiliac joint like this, because the sacrum's in deep there. So once you lay face down with your head this way. So you'll come across the iliac crest, and then come down and hook under the PSIS, and then, so here I'm on this PSIS here, and I go just medial to it, okay? And then sometimes you do it with the same side leg or the opposite leg. You come out like this, and then you kind of jiggle the leg like that. So I'm going here, and when I do this, it's pulling this ilium out this way. So it's what's called sometimes a gapping test. So you're trying to open the back side of the SI joint. I'm moving this out like that. So I'm feeling between the sacrum and the PSIS. And then you can also feel it on the other side too. So you're trying to assess motion of the SI joint. So that's what they're showing in that image. Okay, so I would say it would be a good thing to, while we got these tables up, and then if you're wearing a skirt, face this way so there's no mirrors and stuff like that. Okay. So I think that's it. So then again, now they're just palpating. If you have the greater trochanter and you go a little bit posterior and down, then you're going to feel this gluteus maximus, gluteal tuberosity. Okay, so it's a little bit of a lump on the femur there. And if you contract your gluteus, you can feel it contracting right there. So you're going from the greater tuberosity, or greater trochanter, you're going inferior and a little bit posterior, and then you feel kind of a little bit of a hard bonier part. And then if you feel that gluteus contract right there. So again, the pubic crest and the pubic rimar, pubic tubercles, that's not copying yourself, or you're using someone else's hand to copy that. And I'm not necessarily going to get into these portions here. Ischial tuberosity, that's pretty easy. Okay. So then you also want to be familiar with an image of the front side of the thigh like this. Okay. This one's a little bit more straightforward until you start getting into this area here. Because obviously we know what this one is going across, right? And then what's this on this side? Vastus lateralis, right? And then, yeah, so what's this one here? What is it?
That's the rectus femoris.
Yeah, because remember it's the more superficial one. And then what's going to be on the medial side? vastus medialis, right? And then this would be the so-called VMO. Okay? So then it gets a little bit trickier in here, but you understand the one that's going to go straight down this way would be what? Gracilis, right? Okay. And then this, you're going to see the adductor longus here in the pectineus, not so much the magnus. The magnus is going to be farther down on the other side here.
So where would the vastus intermedius be on that?
Underneath.
The,
Yeah.
Okay.
Usually when you see vastus intermedius, it's only when this rectus is removed. So it would be like this. If the rectus is removed, then it's going to be underneath here. Because again, it's going to come down lower off to the middle portion of the thigh, as opposed to the other ones are going to come up higher. So then again, when you're looking from the back side here, it's pretty easy to identify what's on the lateral side is going to be what? Biceps femoris. And then on this side here, you're going to have the membranosus. Remember, it's a thin muscle, and it tends to go on either side of the tendinosus. So the tendinosus is going to be this tenon one that's going to go farther down. So if you look at the muscle here and you see that it goes farther down here, you know that's got to be the tendinosus. Versus the membranosus can be on either side of it, and it's going to stop short. Right? And then again, you're going to have the gracilis. If you see it going down, and it goes to that same place here. And then the adductor magnus, remember you didn't see that from the front, that's the one you're going to see from the back. So the adductor longus and pectineus you're going to see from the front, magnus you're going to see from the back. And then what would this one up here be? It goes into this TFL, right? Because you have this iliotibial band that the glute also goes into. And then you can palpate the iliotibial band like right along the side here. Right? That's if you go from the biceps femoris tendon and you come anterior, basically right along the side, you can feel that it's not like a tendon, like a specific rope type thing. It's more of this band right here. Okay, so if anybody has trouble finding that, let me know. We'll make sure you do. Okay, because if you go down to the side of the knee, you feel the fibular head. It's a little bit anterior to that. If you come at the fibular head, you trace that, you feel the biceps femoris, you go a little bit anterior and you're hooking under the edge of the TFL, I mean the iliotibial band right there. And then you can kind of feel the front part of it, and you can sort of grab it right here along the side. Did everybody find that?
Mm-hmm.
And then you trace it here, goes all the way up, and then what does that go to right there? Right.
Press it.
To TFL. Let me show you another thing here. Can you come on? I guess you might as well.